Planning for the future entails investing in one's health to better prepare for economic uncertainties and reach financial goals. We discuss this and more with Manulife Philippines President and CEO Rahul Hora. Rahul, great to have you with us. Which health-related anxieties are very common right now among Filipinos?
So first of all, thank you, Rico, for inviting me to your program, and always exciting to be here. And yes, so before we get into that answer, I just wanted to share that we at Manulife conduct what we call as the Manulife Asia Care Survey, which we conduct every year, and we did that in 2023 as well. And as an outcome of that, we got to understand what kind of anxieties do our customers, on a day-to-day basis, the Filipinos are facing. And I think the anxiety that is currently being faced by our customers topmost are the financially related anxieties which associate with critical illness. 49% of the customers were worried about the cost of the treatment, which is associated with the critical illnesses. And also the next, top of the came in was at 37% was our loss of job or possible loss of, income due to illness. So these were the two topmost anxieties that came across when we did our survey with our customers.
In terms of the illnesses, Rahul, what are the ones feared the most?
These are the most common ones, Rico, which whenever we do surveys, they come up always as the top three, which are, the top one is always heart diseases. The second one was diabetes, and the third one was cancer. But very interestingly, this time when we did the survey, there are two, diseases or concerns such as depression and anxiety. We actually came in the top five as a 5 and the number 6th rank, which was, which is actually quite intuitive because we've been talking about mental wellness quite a lot. But it was quite surprising to see these two, anxiety and depression coming up at number 5 and number 6 as top concerns for our Filipinos.
And Rahul, do these health-related anxieties pose economic challenges?
Yes, definitely, Rico. I think I would just like to, stress upon the following points, right? Number one, the average longevity of Filipinos is increasing year on year, and currently it is at 72 years. Then couple that with high increasing medical inflation on a year-on basis. The medical cost, the inflation is almost at about 12 to 13% on a year-on-year basis, which means that the Filipinos will live longer, will have to continue to deal with higher medical expenses on a year-on-year basis, and the level of preparation that we see on a financial basis is not there as yet. So which would mean that a lot of our customers will end up relying on the social service or the public health programs that the government has, which of course puts a lot of pressure on the government and on the economy, and that's one aspect of it. The other aspect is, of course, if we have a non-healthy or not a healthy citizens, then of course it impacts the productivity, the economic output,
right,
and the productivity of the Filipinos. So
yeah,
there are these two impacts that health concerns have on the economy.
So tell us, Rahul, with these health-related anxieties, what should be the financial goals of Filipinos before they retire?
I think I think one of the things that we surveyed is what we call as wellness longevity. So we asked our customers that for how long do they expect to stay healthy, and interestingly, a lot of customers feel that they would be staying healthy to the age of 62 years. And in fact, the new millennials are even more pessimistic. They feel that the health longevity for them would be about 55 years. So keeping that in mind, most of our customers are actually today, we're observing, is going for savings for health expenses because they see these health expenses or challenges coming into their lives much earlier. So along with retirement, planning for these health expenses is really coming up quite high, with our customers, and what is it that their preferences are in terms of savings and the reasons for their savings.
But how important is it really for Filipinos to invest in their health? And how soon should they be making that investment?
Definitely extremely important, Rico. As I said, I think Philippines is one of the country where out-of-the-pocket medical expenses is one of the highest. If we compare ourselves with some of the peers like Indonesia, like Thailand, we find that the out-of-pocket medical expense is the highest in the Philippines. And then if you couple this with the savings rate, the savings rate as a percentage of GDP in the Philippines is only at about 10%, where again some of our peers are in high 20s or even high 30s, which means that a lot of money has to be spent by the customers out of pocket. And of course, the savings are not there adequately enough to cover those expenses. The urgency for the customers to really start investing in health is extremely high. And the earlier they start, the better it is, because you get a larger number of years to do that savings. And of course, health products, if bought early, when your health is in good condition, you always end up paying much lower premiums for the coverages that you want.
And collating all of these issues, Rahul, health-related anxieties, you have economic challenges and financial goals. Has there been now a rising demand for insurance?
Yes, absolutely. In fact, when we did our survey, and especially coming out of this COVID crisis, right, when we did our survey, we found 77% of the customers surveyed were positive and were inclined to buy an insurance product in the next 12 months. And 75% of those wanted to buy a health plan. So the interest level has gone up and the willingness to buy has gone up. And there's a lot of education overall in the, driven by the industry that is also driving that behavior, where the customers are getting more aware of the kind of products they have access to, and of course, the need of insurance. So we see a very significantly large level of interest and uptake into the health products at least in the last couple of years.
Manulife Philippines President and Chief Executive Officer Rahul Hora, thank you so much for joining us on The Final Word.
Thank you, Rico.